Afternoon. Welcome to the webinar on COVID-19 and how regions are responding to this challenge. I'm Chuck Bean, Executive Director of the Metropolitan Washington Council of Governments, and I'll serve as moderator. On the line, we are joined by representatives from three regions. We have Josh Brown, Executive Director of the Puget Sound Regional Council in the Seattle area. Mark Fine, who's the Director of Municipal Collaborations of the Metropolitan Area Planning Council in the Boston area. Art Yoon. Art is the Director of Policy and Public Affairs, Southern California Association of Governments, the Los Angeles area. So each of our regions is facing their own issues, and we'll learn more about that in the next hour. NARC staff have prepared some of these slides, and as of 10 a.m. today, many of us are tracking the Johns Hopkins dashboard. I think it's called the Johns Hopkins University Center for Systems Science and Engineering COVID-19 tracker. It's now present in 118 countries, affected more than 120,000 individuals, and resulted in over 4,000 deaths worldwide. In the U.S., the information we have is that there are 1,000 cases in 42 states in the District of Columbia, and then of course two cruise ships in American seaports. So rolling into our webinar now, local and state governments and regions are developing policies, guidance, practices to respond to COVID-19. Governments and regions are developing a range of guidance for their own workers, for residents, businesses, and the general public. And just a quick scan before I tee up Josh. What I've read is that San Francisco has either discouraged or banned large gatherings in public buildings, and the state of Washington, Josh can confirm this in a moment, urging residents to maintain their distance from one another. King County in the state of Washington is, I've heard, ordered county workers to telework. Going to the East Coast, Governor of New York has asked companies to allow employees to telework and established, I think the term is containment zone in Westchester County. Around the country, some cities and counties are canceling public events. Miami has canceled the Ultra Festival, a music festival that brings together 150,000 people from around the globe. Also the Calle Ocho Festival. The California again, Santa Clara County has banned or at least discouraged gatherings of more than 1,000 persons. This was a similar announcement just from the District of Columbia a couple of hours ago, recommending discontinuance of gatherings of more than 1,000 persons at our convention center in the DC area. Some of these conventions are being canceled. We've heard all about South by Southwest in Austin, Texas, which I understand is discouraging or banning. I'm not 100% sure of some of these verbs, discouraging or banning, gatherings of more than 2,500 people. I think, Mark, when I get up to you in about 12 minutes, I understand Boston has canceled the St. Patrick's Day parade. I think I heard the same in Chicago. Mark, you'll confirm or not if the Commonwealth of Massachusetts has declared a state of emergency.
We have.
We've heard about university saying to their students, don't come back from spring break, Harvard, others. Thing that we're struggling with in the region is coordination with the school systems. So what I'm reading is public school systems in New York, Washington State have canceled classes and are offering online classes. I'm not an authority with this information, but I think these are things we're looking for. Public transit information, there's a release from our local transit, WMATA. I know the LA County Metro Transportation Authority and BART in the Bay Area and MARTA in Atlanta are all issuing messages. So quick scan. Now, the goal of this webinar is to provide us with concrete information on what cities, counties, regions are doing to address the spread of the coronavirus, whether the word be containment or really now mitigation. So I'm hoping Josh and Mark and Art, we can drill down to the municipal, county, regional levels, what they're doing and how things are being coordinated. So kind of for the listeners, there might be 5 things that we're going to drill into, a little bit of situational updates. So in a moment, I'm hoping that Josh can just give it a little bit of a narrative of how things had developed there over the last month. I think then Mark, what's picking up in the Boston area. Then I'm hoping number 2, messaging across jurisdictions. There's a role for COGS to help with that. Local government operations, what that means for what local governments are telling their own employees and other policies. What levers are out there that are being pulled by cities and counties. And then I think this call is not really about COGS as enterprises, COGS own continuity of operations plans, ourselves as an organization. NARC may hold a different webinar on that about what we are doing as employers for travel policies, telework, meetings turning to virtual meetings, that sort of thing. It's higher level than that. So that's enough of Chuck talking. I'll come in at the end and share a little bit more about the Metropolitan Washington Council of Governments, the DC area, if there's more time. But now I'd like to tee up our first presenter, Josh Brown, Executive Director of PSRC, Puget Sound Regional Council, which at least until now, Josh has seen is among the most cases and severest impacts of COVID-19. So Josh, please.
All right, Chuck, thanks so much for moderating, and thanks for NARC for setting this up. So certainly not a call I think any of us would like to participate on, nor at least for our community be recognized as the epicenter to date, but good opportunity for all of us to exchange best practices, learn from each other, and compare notes. I'll just start off with a couple of things. First, our role at PSRC is quite limited in terms of serving as the cog for functions that are really being exercised at this point. So when it comes to public health functions in Washington State, those are nested at both the state and the county level. When it comes to emergency management procedures, again, at the state and county level. So I know a lot of your agencies will play a much more active role in terms of coordinating with your board members and local governments. Ours to date has been pretty limited. Our work at PSRC is very much focused on transportation, land use, and economic development planning. So you'll hear a little bit, and I know, an opportunity for a future conference call might be thinking about some of those operational issues for our respective agencies. But I'll kind of fly through some of the things that we've begun to do just in a limited extent because we don't have that direct role. But what I've seen over the last week has been really strong regional collaboration in the Puget Sound region. All 3 of our county executives, who 2 of whom have been our past and our current presidents of my agency, are working very hard and diligently together to collaborate and to coordinate policy. I was a little late getting onto the phone call because we had a press conference that just wrapped up not even an hour ago with our governor and all 3 county executives and mayors of the larger cities that is now issuing a new directive to the population, which is limiting meetings or rather limiting both recreational and optional gatherings of 250 people or more. So what is that going to mean? It's going to mean in a couple of weeks when the Seattle Mariners were going to have their opening day, they'll probably play the game at our home ballpark, but they'll probably aren't, at this rate, aren't going to be anybody at the ball game. So that is just late breaking from just, again, within this past hour being announced. But how this has accelerated has been quite remarkable. It was a week ago where there was a press conference with our local public health officials that began to, I think, really elevate both the concerns and the directions that are being given to the general population. At that press conference, what was announced a week ago was that all employers should begin to implement teleworking procedures for their employees. And the second component of that was limiting non-essential meetings. So, of course, the work that we do at PSRC is a lot of those non-essential meetings. That's one of our real strengths, like your agencies, playing that convening role, bringing people together. So when that press conference wrapped up last Wednesday at about 2:30, 2:45 in the afternoon, I immediately met with my management team, and we began to put in place immediately a direction to our employees for mandatory teleworking, which they're doing. We're going to be in the process of extending that another week. Our approach has been extending and reviewing those teleworking procedures on a week-to-week basis. We had a board meeting the next day, which we canceled the afternoon before. And I think to the credit of our board members and staff of the region, we didn't have anybody errantly show up at our boardroom. Folks are getting and paying attention that these are unusual times and taking real responsibility. And I think the other thing that I would highlight is the efforts of the large employers in the region. Amazon, Microsoft, other large employers working through the Seattle Chamber have been very supportive, very organized in taking a leading role in terms of doing everything that they can with their workforce to, again, cancel non-essential meetings, promote teleworking. Microsoft and others are looking at things such as for hourly employees that may not be needed for the foreseeable future, compensating those employees, even if there's not a task for them to do, just knowing that these are really challenging times. The last thing I wanted to maybe wrap up with is, like many of your regions, even though my agency plays a limited role when it comes to emergency responsiveness and emergency management procedures, because we're in the Seattle region where we've had volcanoes explode, where we are prone to earthquakes, my agency has put in place a lot of very strong preparedness policies, with the idea being that at any time, with no warning, we could have a major earthquake that could prevent us from getting to our office building downtown, stranding employees, preventing us from being able to connect as a staff. So those procedures are really paying off right now. Being able to do things such as, continued direct deposits and payroll, updating and setting up systems so that when we need to have board meetings that are call-in procedures in place that are strong and there's technology that we can use, and we won't encounter those disruptions. I just can't stress enough that a lot of that work that we've done for natural disasters has been very helpful to make sure that we have, in essence, a leg up on this circumstance, and we're learning other things that we should be doing as part of that disaster preparedness work, but that's really given us a leg up in this situation. So with that, Chuck, I'm happy to kind of keep it as short as possible and answer any questions that folks might have. I think you want to maybe take those at the end.
Yeah, thank you, Josh. I think we generally will take it at the end, but I think if you could just give a little bit more of a flavor. I think you caught all of our attention where you all were a week ago and where you are as of today, and where you go from public officials giving broad messaging and where guidance then turns to bans. And could you just kind of reiterate bans on gatherings and that sort of thing? Could you just go over that one more time?
Yeah, so yes, I can. So a couple of things. One is, I think what we've seen from last week to this week is an evolution in terms of what is being directed by public health officials. Last week, that direction was from our public health officials to, wherever possible, use telework for large employers and cancel non-essential meetings. So, again, using PSRC as an example, it was very easy for us to get our staff on Wednesday afternoon together and say, starting effective tomorrow, you need to telework. Now, the government and our public health officials were not directing employers for mandatory teleworking, but we were directing our workforce to mandatory to telework, and that is mandatory. So that was our direction as an employer. And again, to the credit of employers across the region, they're looking at the suite of work that they do, and working with their employees that if you can telework, you should. As of right now, public health officials aren't mandating it, but they're directing employers that this is something that should be promoted, that you need to work proactively with your workforce on, and folks are doing that. The second part has been meetings. So a week ago, the directive from public health officials was any meetings that were non-essential, if you can cancel, reschedule, replace with a teleconference, a Skype call-in, do that. And the threshold for meetings in terms of what a non-essential meeting was any gathering of 10 or more people. So for us, the next day when we were going to have one of our policy board meetings, it was pretty obvious that when the county executives and the public health departments that they lead are directing that non-essential meetings should be canceled, well, it made sense that we canceled the board meeting the next day. What's happened a week later, and again, what we're all, I think, trying to understand, because this is, really late-breaking news from just this morning, was the governor and county executives and public health officials now have said, so beyond those directives to large employers, we now are going to put in place directives in the three largest counties in Washington State, King, Snohomish, and Pierce County, that any recreational gatherings above 250 people, that those now should not move forward. So again, what is not included in that was, I understand it right now, and again, digging through all the late-breaking information, schools aren't included in that. Retail establishments. So, clearly when all of us go to Costco, there's probably 250 people at Costco at any given time. That's not included. But what would be included would be sporting events, conferences, other gatherings that would be optional. One of the things that caught my attention, and I think somebody has some feedback there going on.
No, complete your thought, Josh. This is Chuck. Complete your thought.
Oh, okay. I was going to say, the thing that I think is a little bit of a gray area that the governor mentioned, which I think we need to dig a little deeper to understand how this might actually, how this might be carried out, was he made a comment about, well, if you have a crowded bar, we're asking bar owners and different establishments that, if you have large gathering of 250 people, you just shouldn't have it. So that is different from what was announced a week ago, which were suggestions, is I guess maybe a way to appropriately say it, to employers to promote teleworking and cancel non-essential meetings. Just this morning, now we have a firm direction carrying the legal enforcement procedures, saying, if you have a large, baseball event or something along those lines, those aren't going to move forward.
Good.
More to come for sure.
Yeah, thank you, Josh. I got about 5 questions, but I'm also interested in the Boston area. And Mark, can you kind of tell us what you all are experiencing, the lay of the land with the cities, counties in the Boston area, and MAPC's role.
Sure. Well, I mean, in some ways, I think Boston's probably slightly behind on the kind of curve of escalation that Josh just shared with us. I mean, we haven't had quite the numbers that you've been finding in the Seattle region yet, but I mean, our numbers, have doubled, yesterday, and they've gone up again today. So I think like all of a sudden this week between, I'd say, the last 2 days, really, everything's really ramped up from, the governor's level and the state of emergency that he declared in Massachusetts to, further guidance around travel and especially around, what state employees could do. We're an independent state agency and we often follow the state guidelines around, kind of personnel policies and work. So, we've obviously had to, we've been then adapting to that. But I mean, I'd say, one of the roles that we play as MAPC is we, in my department, which is, a municipal collaboration, we're not really a planning function in the kind of conventional sense. We do homeland security, emergency preparedness, grant management, and planning. And we also coordinate health and medical coalition work for one of the regions of Massachusetts. So we're kind of patched in then with, hospitals, local public health, long-term care facilities, community health clinics, in leading on one of those coalitions, which are under the auspices of the state's Department of Public Health. So, in the role on health and medical coordination, we have a few staff who actually play a duty officer role. So not only do we help, manage the preparedness activities that our health and medical partners are pursuing through some of the federal grant money they receive, but then we also have a duty officer role, which in a sense is, they're kind of on an emergency basis when, health and medical partners, need assistance. And, I would say, even before sort of, our region started to really find the numbers ramp up and the kind of policy response ramp up, you did see a lot of resource requests start coming into our duty officers. And I think, as everybody knows, there's been a shortage of personal protective equipment, PPE, and especially these, the N95 masks. That's a shortage globally, I think, and a lot of our health partners started to call our duty officers to ask for requests to access additional protective equipment for their staff. And, if anything, that kind of ramped up in advance of sort of the kind of cases ramping up. And I think, if anything, it was kind of like a leading indicator that, our sector, our health and medical community is getting prepared for what they see as a spreading outbreak across the region, and they were looking for, equipment they need to address it. So, I mean, in some ways, the role we play with health and medical coordination, we're not here to direct local public health or hospitals and what they do for emergency preparedness. I mean, they are, the experts in that. But we're here to coordinate across disciplines, share information across disciplines, and help communicate, information from the state's Department of Public Health to the regional partners that we help coordinate, that we help, share information too. So we have, been playing that role. And I mean, I think if anything, from an agency perspective, it probably also gave us a little insight into what is happening and across our region in a way we might not have otherwise had if we were, if we didn't have this role in emergency preparedness, like we do have, in the close relations we do have with a lot of our local public health officials. I would say, because of the role we play and the close ties we have, because we do a lot of, work to help communities share services in my team, and public health has been a big area we've worked in. So we know a lot of local public health officials, and they've gotten familiar with us both through the health and medical coordination function we play, and then also in the, the project work we've been doing on their behalf. So that's also, gotten us invited to the dialogues that local public health officials have had in different parts of our region around the messaging and steps they should be taking to address the issue. So that's been a really interesting, role we've been playing lately. And I think it has kind of aided, the agency in kind of learning about what's going on and helping us better communicate to our local stakeholders as well. I mean, I would say, as an agency, we also do coordinate some of our bigger communities in a number of almost, legislative and policy advocacy communities. So we have a Metro Mayors Coalition, which, all of our kind of biggest 15 communities are involved with, so Boston, our biggest city, and then a lot of the smaller cities that are around Boston are all part of that. And for instance, they want to help get their messaging sorted across municipalities, because, when one municipality, and one thing I think everybody's been concerned about is just when one municipality, announces they're taking certain action, all the neighboring municipalities start to get a lot of calls from local residents, like, why haven't we done the same thing? And, they're doing this and we're not doing that. And I think, there's been, pressure on a number of our, municipal leaders and local public health departments to sort of be able to respond to that. So the Metro Mayors Coalition is actually, bringing together a meeting to talk about how they can kind of share that communication across communities. And, there's another meeting that we'll participate in with our North Shore public health departments as well. And both are kind of about coordination and communication between and among local communities, so they can, better kind of share messaging and insights across themselves. I mean, one thing we don't have, and I think, as Josh mentioned, you've been able to use kind of the state and then also these county executives and the county governments as a key party in coordinating the response. In Massachusetts, as I think probably some of you are aware, we really don't have counties. So we have the state, and then we have, the 351 municipalities in Massachusetts, of which 101 are in our metropolitan region. So, coordinating, at kind of a regional level on issues like public health is difficult. But, that's where like the health and medical coordinating coalitions have come in. That's where, some of these other coalitions like Metro Mayors have come in, where they can, at least that's where they can convene the dialogue, either between communities or between communities and the health and medical stakeholders, like the hospitals, long-term care facilities, and community health clinics, which, are essential to the response as well. So, I mean, and without the kind of county architecture, we've been, helping to facilitate, those kind of intermunicipal and cross-sectoral conversations as well. So, I mean, that's been some of what we've been doing. I mean, I think, as much as, I think like Josh, like we're not directing the response, but we are helping to facilitate the dialogue among the parties that need to respond. And we are keeping close tabs on what that messaging is, so we can be aware of it. And to the degree others have questions, we can pass their questions and information on to those people who can best answer them. But I would say, it is worth noting, and I think this is probably true in a lot of states, but like, a lot of when it gets to sort of an emergency of this nature, it really does, the state becomes the primary party. And I think a lot of things start to pivot around the actions that the governor and the State Department of Public Health take. Nobody wants to get too far out in front of where they are. At the same time, if the state and DPH aren't kind of moving fast enough, then, it creates kind of I think a level of confusion and concern amongst local parties. So, I mean, this is the week when really, I think, our governor and our local, and our State Department of Public Health really kind of ramped up their guidance with the declaration of emergency. And now I think, you're starting to see, the policies around meetings, that everybody was kind of, implementing on their own. now they're starting to kind of use that state guidance to be like, all right, we got to cancel all non-essential meetings. Public gatherings should be canceled. I know, like this week, we canceled and basically adopted a policy for our agency that kind of follows the state guidelines, but probably went a little further when it comes to just how our employees are reacting. We decided, we canceled, all external meetings. We said we're not going to host any. Not only that, we're saying staff shouldn't attend any unless they get that cleared by supervisors, and it's frowned upon, and everything should be done remotely if possible. And I think what's coming, and it's going to probably, it's a day or two in our future, but right around the corner really is a policy around teleworking and working from home. And I think in that sense, we're maybe because we've been able to watch what other regions have been doing, who've been affected in a more a little more quickly than we have, we've been able to kind of learn from that and say, hey, it's only a matter of time before, they're telling us we have to do some things. We're gonna get out in front of that and kind of prepare the agency to kind of be a work from home type of environment and, take down the kind of external engagement as much as possible. So, so that's kind of the range of, kind of where we are, and that's, how the role our agency plays and some of the actions our agency has been taking to address what's going on. But it's amazing. I think just as Josh said, it's amazing how quickly things have moved between last week and this week. And,
thank you, Mark.
And I got, been happy that, a lot of parties are really taking this seriously as it needs to be.
Good, thank you, Mark. I'm going to use that as a transition. NARC staff, I think we're counting on you to collect when Mark says it's when the state gave this guidance that the jurisdictions were coalescing around that. So these key documents that are guidance or directives, either at the city, county, state level, so that other metro regions that might be X weeks behind can see what's coming. I'm hoping that NARC can help us with a repository of that kind of thing. And I think, Mark, we might come back to you and Josh with questions about how schools are fitting in all this, but I'd like to first move on to Los Angeles and let's see, Art. Art is the Director of Policy and Public Affairs with the Southern California Association of Governments. Art.
Thanks, Chuck. And Chuck and Leslie, thanks for putting this call on together. It's so helpful to know that we're not alone. So like Josh and Mark mentioned with their respective agencies, SCAG sort of has a limited role in public health. Our mission is more transportation and housing focused, and public health is really the province of the state and our counties. But let me kind of give some context about what's going on in the region. So our governor said that California currently has 157 confirmed cases of coronavirus 19. The governor also indicated that 1,075 Californians have been tested at 18 different labs across the state. The state's monitoring an additional 10,300, I said that right, 10,300 individuals who returned to California on international flights and may have been exposed. And many others who've interacted or with the infected people are being advised to self-monitor and quarantine at home. The state's given us basically guidelines. There's 5 levels of response in public health. We're currently at response level 2. To give you an indication what those are, level 1 is essentially social distancing and better hygiene practices. Level 2, which is where we are, is voluntary isolation. Level 3 is involuntary isolation. Level 4 is the cancellation of major events, closures of schools, that kind of thing. And level 5, it would be basically establishing a quarantine zone. So we're not there yet. We're still in the voluntary isolation stage, but it's definitely been rolled out as information to most of our agencies around here, so we're aware where the direction could go. That said, we're not panicking. The state of emergency that I think was asked, I think Neil asked the question what the state of emergency really meant, so let me answer that. So the state of emergency was declared by both the state of California and the county of Los Angeles. And it's not a statement of panic or anything. It's just a designation that allows greater flexibility and control and streamlines decision-making, as well as kind of making the region open to more federal and state aid. That's even though those are the official responses, private sector and a number of other entities have kind of done their own response. So as indicated earlier in the call, I think Chuck, you mentioned, I mean, local universities up and down the state, including a number of the University of California's, including UCLA and Cal Berkeley, private sector entities like Stanford, USC, they've gone to virtual classrooms this week. And most of those schools I just mentioned are going for the rest of the month. There are 32 other universities that have joined them in this last week alone. Public transit, you mentioned Metro, BART and others have been very aggressive with their messaging on healthcare best practices. They haven't suspended activities though. There are large scale happenings still occurring. So like this past weekend, we had the Los Angeles Marathon, which had 35,000 runners. That said, we've canceled other large-scale ones coming up, including the Coachella Music Festival, Stagecoach Music Festival, the world premiere of the 007 movie, which got moved to the fall. AFI, which is the American Film Institute Gala, it's kind of a big deal in entertainment, that's been canceled. The ATP tennis tournament in Indian Wells, and local athletics, including USC and UCLA, all those events are still going on, but there are no spectators allowed, so they're closed to the public. And you've probably heard this morning, I mean, the Golden State Warriors and the San Jose Sharks up in the Bay Area, they're going to be playing their home games for the rest of the month in front of empty arenas. That's sort of what's going on regionally and throughout the state. Let me kind of give you an indication what we're thinking of here at SCAG. Mandatory telework is going to be instated starting next week, from Monday through Wednesday, but we're doing that as a pilot. So we're seeing, in the case of real pandemic, we want to see where the stress is going to be felt throughout our agency. And this is a particularly stressful time because we're putting together a regional transportation plan and our regional housing needs assessment. To do it right now is not convenient, but we're prioritizing public health. We feel that this may be something we're going to have to go to much along the lines of like our friends up in Seattle. We've already instituted a staff-wide I wouldn't say ban, but we're effective now. We're not allowing staff to travel for the rest of this month. Inside the region, if people are going to meetings that are scheduled to have more than 100 people, we are canceling those meetings as well and encouraging people to use telephone or video if available. As far as internal meetings, we're trying to practice social distancing as much as possible. We are definitely putting a damper on that, asking people to use Skype meetings and phones as an alternative. We host a number of large meetings for the community, and those have now been, we're going to keep the ones that are on the books. There's less than 15 for the rest of this month, and we are no longer going to allow our space to be used by the public going forward until this crisis is over. And the biggest source of pain for us is our General Assembly, which is scheduled to be in Palm Springs in 8 weeks. It is our single largest event. Over 1,000 electeds show up in the desert, and it's an expensive enterprise for us. We are on the verge of potential cancellation of that or postponement. We are monitoring the situation, but our focus isn't going to be on like how much skin we have in the game. It's going to be prioritizing public health, and I suspect over the next week or two we will make an announcement on that. So that's in a nutshell what we're doing at SCAG and throughout the region, and I'm available for questions.
Thanks, Art.
Great. Thank you, Art, and thank you, Mark, and thank you, Josh. Let me ask a question of Mark, and NARC staff are going to let us know how participants might ask questions in just a moment. Mark, when you think of your support to your member jurisdictions, there's Boston and others that are large, and there's probably some small towns. Do you see different needs right now of the small versus the large? And if so, how do you characterize that, and what do you do to support them?
Well, yeah, I mean, I think clearly, like we go from the city of Boston, which is almost 700,000 people, to the town of Essex, Massachusetts, which is about 3,500. So I mean, there is quite a range. Obviously, when you think about capacity, our major cities have pretty, well-staffed and capable public health functions, and actually some excellent public health departments in some of our bigger cities like Boston or Cambridge, Massachusetts. But it really ramps down after quickly to what you'll find in a small community is they might, they'll have a public health agent that's largely, there for inspectional services. And then, they might have a part-time public health nurse, somebody who's there, as little as 5 hours a week, and often maybe does some flu clinics or some home visits or things like that. But really the capabilities are amazingly limited when you get to the local level at some of our smaller communities. So, I mean, if anything, I think the thing that has been, that we can do is kind of encourage dialogue, because, the one good thing is the public health community does have these public health emergency preparedness coalitions, of which we help kind of coordinate a few in our region. And that's where local public health officials can get together to share information and response, and actually provide some mutual aid. So, in a situation where a nurse is overwhelmed by, infectious disease calls or, being asked to check on people, they can seek the support of other neighboring communities. But I would say, I think if we were, given the lack of capacity in some of our smaller communities, if the outbreak, continues to grow apace and you're seeing clusters in some of the smaller communities, they're going to be really strapped in their ability to respond, and they're going to really have to rely on the state to step in and provide that support. It hasn't happened yet, but, I fear, if it happens in some of our smaller communities, they're not going to be able to address it themselves, and the state would have to step in.
Thank you. Question to Art, going back to I think it was the 5 levels of public health response. For me, I think other regions around the country are looking for common denominator, common language between County X and adjoining County Y. And this level 1, 2, 3, 4, 5 might be really helpful to a number of us. Art, who pulls the trigger? Is it the state, or is it the county? Is it a city? On what level we should be at?
Well, in our case, it's Los Angeles County that pulled the trigger. So they're the ones that indicated we're at level 2. But like I said, despite what they've said, I mean, private sector's kind of done their own thing, and level 4 cancellations of major events are already occurring.
And what does Orange County do as Los Angeles County goes to level 2, if you will? Well,
thus far, Orange County hasn't, at least if they have a formal system, they haven't put it out for public information. I can say that a lot of the things that are considered level 2 activities, they've already instituted, but no one has moved into level 3, which is the involuntary isolation. That has not occurred yet.
Okay, thank you. I think, I wasn't as interested, of course, in Orange County, just how there's county to county cohesion, and trying to agree on what the levers are and pull levers at the same time in terms of a region. So Eli Neal, how do participants ask a question?
Thanks, Chuck. This is Eli. Participants can type in a question in the little question box, or we can also have people, if you have audio control, you can raise your hand and we can toss audio control over to you. We have a few questions that have already been typed in. Chuck, do you want me to just read those out? Are we ready for those?
How about, why don't you read 3 at a time, and that way we can just pick them up as efficiently as possible. So read the first 3 questions.
That sounds great. All right, the first question is if any members of the panel have thought about or have established policies for staff to host in-person public outreach events, interested in learning about when to cancel or when to make them online.
Okay, and that's, I think, pertains to the COG itself. Is that right?
I believe so, yes.
Okay. All right, so let's fire up, let's get another question ready.
All right. Next question is, did the tone of official messaging and the choice to move from broad statements to bans on gatherings coincide with cases where transmission was the cause as opposed to travel related causes?
So I think I'm understanding that is, are folks looking at when a case is travel related versus community transmission related, does that pull different levers? Is that a fair understanding, Eli?
I think you've got it.
Okay, and the next one?
And then the next one is, does anyone anticipate a COG role in allocating or programming federal aid that may come to states related to coronavirus?
Great. So Josh, how about you get first dibs at any of those questions?
Sure. So a couple things. First, what I'm having my team do when it comes to all the meetings and convenings that we have is we usually have a recess for meetings in August. So we're beginning to game plan through the month of June and July. Essentially, what are those essential meetings that we need to have? Anything that wouldn't be targeted as essential through the summer, then we would replace with, webinars, teleconference calls, etc. So we're already actively doing that. Eli, what the other two questions were what again?
Well, that's okay, Josh. Let's just see any of the three questions, Mark or Art, in-person outreach, travel versus community transmission. Does anyone see a COG role in federal aid? Mark or Art?
I could weigh in on the last piece.
Yeah, go for it.
Well, yeah. So on the federal funds, I mean, obviously, I think the federal government passed a new supplemental appropriation of $8.3 billion, for a variety of kind of response efforts, and about I think $1 billion of that was supposed to, was slated for the Center for Disease Control and through them to the states. And, it did say that the money is supposed to go to public health emergency preparedness recipients. And I don't think we've seen any guidance yet on whether that is funds that's going to hit the state and then go out to the regional coalitions like the Health and Medical Coalition that we coordinate. But it's a possibility that they might, use those pipelines that exist now for public health emergency preparedness grants to disseminate some of those funds. It's just a question of whether it stays at the state level or whether they look to the regional coalitions to help expend some of that resource and use it to build capacity at the local level. But we really haven't heard, and we're sort of aware of what the language in the legislation says, but we haven't really heard what that might mean on the ground for an organization like ours that coordinates at HMCC.
Great, thank you. And Art?
And Chuck, I think the second question was the one that hasn't been answered. So basically about bans. So it absolutely coincided timing-wise with the first, indications that this was spread by community spread. And when that happened, I mean, that's when the bans occurred. I don't know for sure if that's the trigger, but I mean, that it did coincide timing-wise.
Great, thank you. Eli, why don't you tee up the next question or two or three?
All right, we've got a couple more here. The first one is, how have your authorities arrived at the numbers 250 for PSRC and 100 for SCAG, by which they delineate a cap on gathering size?
Okay, I think the numbers has to do with the number of cases. The numbers has to do with the type of gatherings that would be recommended or banned. Is that right, Eli?
That is right. Yeah. How did they come up with those numbers for capping a gathering size?
What's magic about 10, 250, or 1,000, that sort of thing. And all right, next question.
The next question is, how are agencies dealing with the prospect of sick employees running out of sick leave or other paid leave to take care of family members, kids home from school, etc.?
And Eli, do you think that pertains to the COG itself, or do you think is it the broader community, or it could be answered either way?
My guess would be the applications for the COG, but I think it is an interesting question for the community as well.
Okay, so Josh, Art, Mark, either of those you want to pick up on?
Yeah, I could. I mean, maybe just. Oh, go ahead.
Oh, go ahead. I was just going to say, on the, you know, on.
Go ahead.
So when it comes to the number, you know, these are being developed by public health officials. My former public health official when I was a county commissioner is now the state's top epidemiologist. So they're privy to models and analysis to help understand how do you manage these conditions. So that's what we're relying on. Folks that, you know, have spent their careers, you know, dealing with these issues, and that's what we're relying on. In terms of the question about sick leave and, you know, and approaches as an employer, something I can't stress enough is, you know, our agency and our large businesses and small businesses within the Puget Sound region, business is not going to be as usual, right? So as part of a conference call with my management team today, you know, next week we're going to have to do time cards. Well, what are our procedures to you know, approve those time cards and to you know, be able to work with our employees to be able to come up with procedures that make sense under the conditions. I think all employers are going to have to look at that and realize, you know, this is not like it was a week ago. We're going to have to do things different. We're going to have to make exceptions. We're going to have to look at our employee manuals and come up with what makes the most sense for our agencies and for our employees. So I think every employer is going to have to begin to ask those questions. And just as I've been on this phone call, to give you an example, you know, as part of my earlier call with my management team, we talked about what we may need to do for our employees if kids start coming home. I just got an announcement from Seattle Public Schools where my 11-year-old goes. They're going to be canceling school for the next 2 weeks. So this is how quickly this is evolving, and I think all of us as employers and working with, you know, our communities, we're going to have to just normalize the fact that things aren't normal. We're going to have to do things different, and we're going to have to really be thoughtful about what we do under these circumstances and be really open to evolving.
Thank you, Josh. My observation is we're continually looking to the authority, the gold standard to tell us, as this question about the number, you know, is it 250, is it 1,000, is it 10, looking to the CDC or the state authority. So I think, Narc, as you're able to help us understand what are the gold standard kind of common denominator guidance or policies, that would be great to share. Mark or Art, either of these questions?
I mean, I would say, you know, just on the capping kind of gatherings around a number. I mean, we actually took the step just to cancel all kind of gatherings where we're bringing together external parties. We're not going to host any public meetings or, you know, so we didn't really even, you know, use a number. We just went that far. And I think in part because, you know, if we can do our work without the meetings, then why not do it? And, you know, non-essential meetings are just not needed at this point. So that, you know, no number, just a kind of almost a ban. And that's really an internal agency policy at this point, a little further than what the state or other officials are recommending.
Great, thank you.
I would say, you know, I mean, on the paid sick leave, I mean, I think the agency's moving towards, you know, we're going to try to make sure that any staff who, you know, kind of, especially new staff who haven't accrued much, any staff have you know, can get additional paid sick time, and we would cover that.
Great.
And
So,
Chuck, if I can just jump in here for a moment, this is Neil. I just wanted to underscore or respond to your question. We are in the process right now of gathering documents from the state, the city, the county, and the regional level that will be on our website, and people will be able to download those documents and As I think you'll be noting very shortly, if people wish to submit anything to us, they should forward them to Jessica at jessica@narc.org.
Jessica@narc.org. I think some of these internal policies I've been impressed with. Our colleague from Houston HGAC, Chuck Wemple, shared a memo that he sent to all staff on some of their internal policies. So Jessica, Eli, I hope that you can kind of assemble these in appropriate buckets or branches of activities so we can Right. So, start getting a phone call there. It's muted. We're better. Eli, is there another question? Maybe should we give this another 10 minutes?
We can certainly. We've got another question here, so we can go through this. And yeah, as Neil noted, we have a web page up now. It's not fully populated, but we would love to add as many resources as we can, and we'll work on trying to organize that so it's as useful as possible for everyone.
When should we look for it to debut, Eli?
Sorry, what's that?
When will it be up?
So we have a page up now. It does not have everything that I think it could have, so we will be adding resources and updating that. But we currently have a page up on the website. If you just go to the homepage, you'll see it's the most recent post.
Good, good. So let's take this last question, and then Josh, Mark, Art, after this question, I'll ask for any final wrap up. So Eli, you got a question?
Yes. So the question is, a lot of the guidance on response is coming directly to the state, to counties and county managers. If there is not a strong pre-existing coordination among county managers, how are you facilitating this without creating another layer of government? They added, we have some counties that play nice and others that don't. And they're trying to keep them in communication, but don't want to just add to the noise.
Anybody want to pick that up?
This is Josh. I mean, so we have 4 counties in our region. You know, my observation has always been that the public health departments and the public health officials of each of those counties are very collaborative and work very closely together on a host of policies. So my sense would be, and we have the same type of regional fissures that all of your regions have, right? Yeah, those might exist on land use, on transportation policy, but folks, at least in the public health realm, and I think it would be the same thing if there was a natural disaster on the emergency management side. You know, these folks are true professionals. They work closely together, and you know, all indications to date is that they've been doing just an amazing job under the circumstances trying to develop a regional response.
Hello?
Others want to pick up that question? It has to do with the regional coordination. While we're waiting for Mark and Art want to jump in, I would say in our region, what I'm observing this week is there's different needs depending on the size of the jurisdiction. Fairfax, Montgomery, Prince George's, you know, they're all over 1 million people. Several 100,000 in Loudoun and Prince William. They have sophisticated staff, pandemic response plans. If they're communicating, it's about coordination. It's about, if you're going to pull a lever, I want to know beforehand. Our smaller jurisdictions, you know, those under 100,000, maybe even more so, some of our members are under 50,000, their questions are about capacity and their own internal operations. So what we're thinking about is how do we provide value added to the bigger, which is let's say the same things at the same time and also supporting the smaller, perhaps through more of the peer exchange, get the robust telework, interim telework policy in place as fast as we can. So these are the things that we're working on right now. So Josh, Mark, Art, let's go to some final wrap up for the three of you.
Yeah, so this is Josh. Just one thing we haven't talked about, and it's a good follow-up from the last question about regional coordination. While that's absolutely happening at the county and state level between all of our officials and the, involved with public health, we've already had a couple schisms show up when it comes to one of our county executives and the response that, they're putting in place. And a different perspective on, well, how is this going to impact my community from a couple mayors? So something to just maybe put an exclamation point on is that, again, and I recognize it's different in Massachusetts without counties, but because so much of this decision making is rested with the governor and with county leadership, that's maybe a point where many of our mayors don't serve and aren't active with boards of health. So in terms of when these directives come out, different operating procedures, what is the legal authority for both the state government and county leadership? They're just not aware of it. They haven't encountered this. So I just would maybe put that up as an opportunity for all of us to collaborate with the public health officials, just so that there's situational awareness from all of our elected officials in our respective regions.
Thank you, Josh. Mark or Art, are you still on? Do you have a final word?
Yeah. Well, yeah. I mean, I think obviously we're in a different spot in Massachusetts without that kind of county tier. Our public health still is with cities and towns. I mean, if anything, they do have a good track record of working together across town lines when it comes to these type of events. But I mean, I think it does put the state in a much more primary position. And I think to some degree, the state in creating these health and medical coalitions like the one we help oversee, they're looking to these HMCCs to kind of help create that regional infrastructure where the counties don't exist. And I think, a lot of people have questioned over the years, like, oh, are these HMCCs really worth it? And actually, I think, given what we're facing now, there's a lot of people who are happy they're in place because they do spark that kind of regional dialogue and get people across a region talking. So I mean, I think, if anything, it's kind of, pointed to the importance of kind of regional collaboration on health and medical issues.
Chuck, I would just say here in Los Angeles, I know that, public health is obviously the number one thing that people are talking about. And when we're talking about all the measures that we're talking about, that is definitely the thing that we have top of mind. But what's not lost on everyone here is the idea that, any protracted sort of isolations or quarantines has an effect on some of the folks that are least able to survive, economically. And so, like we're talking about telework, there's a lot of jobs that just simply you can't. And they're at risk of losing their jobs. And that's something that we're also thinking about here in Los Angeles, trying to figure out how to not only to protect people's public health, but also their livelihoods.
Chuck, did we lose you there?
We all set?
Sorry, I was very articulate, but on mute. I guess this is going to be the life of conference calls and teleworking to come. So thank you, NARC
Sure.
staff, for putting this together. NARC seeks to act as a repository for policies, practices, statements, messaging, whether it's by the COG, by city, by a county, by the state, put it all together so we can access it, not reinvent the wheel. For some metros, have an idea of what's coming by listening to Seattle, Boston, Los Angeles. Folks, you may forward any documents you wish to share to Jessica and Jessica's NARC staff. Her email address is just jessica@narc.org. As Neil said, the webpage is up on COVID-19. That webpage address, I believe, is narc.org/coronavirus-2019/ narc.org/coronavirus-2019/. Information's already up. I think that this webinar is going to be up there too. So on behalf of Leslie Wallach, NARC's Executive Director, entire NARC team, I want to thank everybody for joining this webinar and your participation. Webinar and slides will be available tomorrow. Neil, especially thanks for putting it together. If you have questions, have additional information, neil@narc.org or leslie@narc.org. Thanks everybody for being part of this webinar, and I know more to come.
Thank you all. Good luck.
Thank you,
Thanks very
everybody.
much, Chuck, and everyone else who's been on the webinar. Thank you.